I spent a lot of time looking at the data to try to get a better appreciation for how many patients are actually using catheters to manage their bladder. But unfortunately, the numbers are largely unknown. We do have the data for Foley and suprapubic, but not really so much for intermittent catheterization. But if we take a minute to review the most common diagnoses that lead to chronic urinary retention, we can get a better idea. So there's currently about 360,000 individuals with a spinal cord injury, with approximately 18,000 new cases each year. And this does not include individuals with spina bifida or spinal tumors or other spinal conditions. There's approximately 14 million with BPH, so we can imagine in that percentage how many are actually using a catheter. 81,000 new cases of bladder cancer every year. So even on the low end, we can estimate there's millions and millions of patients that are using a catheter to manage their bladder. And as we know, even with the best clean or sterile technique, there's always a risk for getting a UTI. So as healthcare professionals, we want to make sure we're doing everything we can on our part to lower that risk. I know everyone knows the impact and how hard it is when someone is having issues and they're having incontinence. I once worked with a patient, this was prior to COVID, and because he was not yet independent with self-cath and he did not have help outside the home, he stayed inside of his house for over 2 years. He never left the house because all he had help was from his parents. And it broke my heart, when I realized there were so many things that we could do and introduce to help him and allow him to do this. And thankfully, fast forward to today, he's cathing himself independently. He's going outside the home. He went outside the home first time with me just to make sure if he had a problem, I'd be there to help. But it really does play a big toll on people's lives. But when we take the time to address these areas, we can have a positive impact on all aspects of life. As a therapist, one of my biggest pet peeves is when a patient has an accident or they need to go to the bathroom, we just hit the call light and say, there you go, nurses, you deal with it. And I'm not saying we shouldn't hit the call light and we shouldn't get nurses involved, but really and truly, we should think about what can we do and problem solve to help support our patients. So I'm going to go over a lot of things today that both of us can do as therapists and nurses to help patients in this area. But in a perfect world, we should really all be on the same page, working together with the patient at the center to help them towards their goals. So again, I'm going to focus a lot of things more on OTs and nurses, but I want everyone to think about all the disciplines that they work with and making sure we're collaborating and everyone's on the same page. So there's a lot of confusion behind what OTs can do, and I blame that in part on us as occupational therapists. We need to educate not only our patients, but other healthcare professionals on what we can do. But OTs don't just work on upper body, and PTs don't just work on lower body. So while it is true that in most hospitals it is organized that way for sake of time, just know that OTs can work on everywhere from head to toe. OTs do obviously play an important role in assessing patients' fine motor control, coordination, their cognition, and where they're doing their occupations. We really want to make sure we're considering their environment so we can be specific on when we're addressing these things. So while it is fairly well understood amongst healthcare professionals that OTs work on activities of daily living, the 5 most common being eating, grooming, bathing, dressing, and toileting, not too many people actually know what it all entails for toileting. So I actually want to take a quick minute to read the OT practice framework definition of toileting. So toileting is defined as obtaining and using toileting supplies, managing clothing, maintaining toileting position, transferring to and from toileting position, cleaning body, and caring for menstrual incontinence needs, including catheter, colostomy, and suppository management, as well as completing intentional control of bowel movements and urination, and if necessary, using equipment or agents for bladder control. So now's time for our first poll question, and I want everyone to be honest. Before today, did you know that occupational therapists could work with patients on catheter, colostomy, and suppository management? And if you haven't had a chance to log in and you don't do the poll, I don't mind old school if you want to raise your hand. So who in here knew that OTs could work on all of those areas, catheter, colostomy, and suppository? So far, at least on there, unless we're still waiting for numbers to come in, it looks like everyone that did it online said that they were familiar with this. So that's good. We got a smart group in here. But I can even tell you, even other OTs, when I do presentations on bowel bladder management and suppository management, they look at me funny and they say, I didn't know OTs did that. So just know that OTs can definitely help patients in this area. But when I work with occupational therapists, I tell them just because something's in your scope of practice doesn't mean you should be doing it. If you take a class of mine, I don't tell you to just start putting catheters in patients. You really want to make sure you've demonstrated competency in this area. So anywhere that we work, we want to make sure that we've done our competency training, we're checked off, and we're only doing things in our scope. So I recognize that not every occupational therapist specializes in intermittent catheterization. So I want to go through some of the basic activities of daily living in areas that any and all OTs can do. So that way when you go back to your respective clinics where you work, it doesn't matter if an OT hasn't gotten formal training in cathing, there's still areas that they can help you out with your patient's goals. So when it comes time to eating, how many of you have had patients that said, well, I'm just not going to drink anything. That way I don't have to cath as often. Yeah, a lot of patients need education on this. You'd be surprised at what patients do when they go home and they think, all right, well, I'm smart. I'm just not going to drink anything, and that's going to make it much easier for me. You also have patients that'll go home and they're like, you know what? I'm going to start drinking. We got the LSU football game coming on, and I'm going to have a six-pack. And then they say, well, Jeffrey, the nurse told me I didn't have to cath for 4 hours. It's every 4, right? But they had so much liquid in a short period of time, they don't understand what that's doing to their bladder. So even just simply doing education for patients on proper fluid intake, especially your patients in an inpatient setting that might be on IV fluids, and they're also drinking those big thermoses throughout the day, and they don't realize that they're getting way, way, way too much in. So we really need to make sure we're taking the time to educate patients on this, and this is something that OTs can do. So grooming, how many of your patients wash their hands like this? How many of you wash your hands this way? So we know that hand hygiene is one of the best ways to prevent the spread of germs. But again, when you actually take the time to watch patients on how they wash their hands, it's not always pretty. So this next video I'm going to show is an example of a patient. I asked him to show me how he normally washes his hands before using a catheter. And this is what he did. Yeah, this is better than most. I mean, some men don't even wash their hands when they go in the bathroom. So for those of you that are not going in the men's room on a daily basis, let me tell you, oh my gosh, it is just amazing. So we shouldn't assume just because our patients are ambulatory and they're able-bodied that they know how to wash their hands. So I always like to, as an OT, assess that. And so even if I'm not doing anything else, if I know a patient has a goal with the nursing team to work on cathing, I want to go in beforehand and teach them how to wash their hands properly. So for dressing, there's a lot of adaptations that can be made to clothing. We can have clothing with much larger zippers to where it opens up much larger from front to back so that the patient doesn't have to take down their pants to cath. There are pants that have the snap button closures. Some people call them stripper pants, so you can just pull them off. It actually has a name. It's called breakaway pants or tearaway pants. You'll see basketball players use these over their gym shorts, but I really love this because you can see in the picture here, you can actually tear it down on just one side, or you can do it on both. So you can really expose that area, make it much easier for patients. When you think about how often patients are having to go to the bathroom and manage their bladder, it can be a chore to get their clothes down, especially for their paraplegic or tetraplegic population. So there's a lot of pants that can be adapted. Just know that this is one of many options that works very well. Okay, so I read the definition of toileting earlier. So again, even if an OT is not actually working on the steps for intermittent catheterization, we can work with our patients on how to get undressed from the wheelchair level. I don't want to think that my patient has to go all the way back to bed every time they want to go to the bathroom. That limits our patients from being able to participate and go back out their house. There's a lot of patients that learn how to do it, but then they say, well, I can only do it from bed. I've never learned how to do it out, so I'm always got to get back into bed, so therefore I'm just not going to leave my home. And I've seen that quite a bit over the years. So we really want to make sure we're getting OT in there to teach patients on how to undress from the wheelchair level. How many of you have had a patient that didn't even know they had a urethra? Oh, I've had several. They thought it all came out the same spot. And so sometimes as an OT, I'm like, we're going to get a mirror and we're going to practice and we're going to really go over things well so that there's no guessing. You know exactly where you need to go.